just across the industry, with the possible exception of Novo and Lilly, almost everybody needs to do supplemental pipeline acquisitions. So the challenge is there aren't many assets like that.
The whole discussion makes me think about how much cash there is in pharma ready to be deployed.
Yeah, it's close to $1 trillion. This is an incredible job. You, me, smart people every day. No, it's true. Well, you and obviously the CEOs that we invest with. Of course you. Lessons learned. Again, I should have probably moved to US earlier because it would have allowed us to scale the organization and the fundraising faster.
Bienvenue to a new episode. I'm your host Philip, and on this show I'm interviewing the best Europeans in biotech to help you grow. Boston is the biotech powerhouse in the world. It hosts many top biotechs, pharma, academics, but also top VCs. And one of them who has a strong European background and connection is Otello from Omega Funds. So I went to Boston to catch up with him. I've known him and followed him for a few years where he has been very successful, especially on the exit side. And he's just a super fun and chill person to talk to, and also has strong contrarian views. So we talked about the highest competitive tension in biopharma today that he has ever seen. We also talked about his challenges and opportunities for moving to Boston a bit over 15 years ago. So here's my conversation with Otello, and if you're enjoying it, please hit the like and follow button. Welcome to the show.
Thank you. Nice to be here.
Nice view.
Yes, you picked a very beautiful day today. It's very nice.
That's amazing. I wanna start with competitive tension in biopharma, especially today. Actually, I saw one of your posts on LinkedIn, and that's kind of the trigger for me to reach out, and that's why we have this conversation now. So, and that was just after one of very nice exit of iBio.
Right.
But you said that you have never seen such a scarcity for clinical stage assets in your past 25 years.
Yeah, I think that's fair.
Can you expand on that?
Yeah, maybe a bit of background. So I used to do M&A when I was in banking in the 90s, and had a nice overview on what was going on in the European pharma consolidation at the time. And I've been a VC now for about 20 years actually with Omega. And before that, I was doing also VC. So I think what's driving the current situation is the result of, I would call relatively macro trends within the pharma industry. So one is the fact that, as you know, pharma companies need to continue to replenish their pipeline. Historically, in addition to their own R&D, they've always done, transactions, partnership, acquisitions from smaller companies. But what was available to them up until a few years ago was also large transactions with other pharmaceutical companies. That's no longer available because of the environment with the FTC in the US. So I think over the last, I want to say 3, 4, 5 years, there's been a shift towards smaller transactions from the pharma point of view. And those transactions have been rewarded. A very good example would be Merck, who has a very large patent expiry in a few years with Keytruda going off patent. And they started really adding to their pipeline via some of these external transactions. Prometheus, obviously a very large drug, and a few others, including some of our companies like Imago. And other companies have done the same. So AbbVie recently with Cerevel and a few other acquisitions. So I think what you're seeing now is a result of a few years of needing to fill in their pipelines. Usually a late-stage clinical asset in our universe would be in a company that's already public. What you're seeing, though, is that the public market has been much more selective. In my opinion, rightly so. That's a different topic, perhaps, but much more selective over the last few years. I get a lot of noise for that, by the way, but again, different conversation. And as a result, companies are staying private for a little bit longer. Again, not unhealthy, in my opinion.
Yeah.
And so what you see is that the low-hanging fruit in terms of very late-stage, publicly available assets that have achieved a certain level of maturity is kind of gone, right? There's no, I mean, obviously it's not a steady state, so there's obviously companies that go public and developments develop.
I guess it's always a gray scale. It's like this less
Right.
like mega deals available, less later stage available, so you end up more pressure on the smaller.
Right. No, that's exactly right. So if you start, not that I'm a person like that, but if you are the head of clinical or the CEO or the head of business development in large pharma companies, and you need to fill in a huge pipeline gap in terms of revenues, you start from, large potential drugs, and those will usually be housed in companies that have achieved a certain size, right? But once you buy those, and there aren't a lot of those, then you need to start going, smaller in terms of size. So that's happened, and that's happened for a few years. And now, as a result, the pharma companies are looking at private companies. So I think just this morning, I believe...
kind of a cascading down.
Right. And also, eventually, by the way, this is going to end up, again, that probably is something for next year and the year after next, but eventually these pharma companies need to also replenish their late preclinical and early clinical pipelines.
Yeah.
So what you're seeing, you started with large public companies, biotech acquisitions, then smaller public company biotech acquisitions, now the privates. And eventually in the next 1 or 2 years, you're going to see probably more large revenue or large biobucks headline preclinical deals or early clinical deals.
Yeah.
So back to your question, I'm sorry, it's taken me a while to answer it, I guess. This is a dynamic that is now industry-wide because there's just across the industry, with the possible exception of Novo and Lilly, almost everybody needs to do supplemental pipeline acquisitions. So the challenge is there aren't many assets like that, and I guess our luck has been that we always focus on clinical stage assets or on clinical strategy. So as a result, we've been very busy. But also as a result, we're seeing a lot of these competitive dynamics play out, which led to the post that you mentioned, which I saw was very popular.
What was it? It's the 20th deal in the last 2 years or something? No.
So since So thank you for pointing that. So since January 2022, I believe, we had 10 M&A exits in our portfolio and 3 listings. Yeah. Oh. And I hope both numbers will go up a bit, but obviously we can't guarantee that. But we are very busy right now.
That's already a lot.
Yes,
that's amazing. I didn't see it. I didn't see the cascade that much, but it's really, I think it makes total sense.
Yeah, and
it reminds me also of in all the trend of, I think it started really a lot in 2008. The really shutting down internal programs, internal R&D, and going more external R&D. So I guess that kind of started the movement, and now we are
within pharma.
Yeah, within pharma. Yeah.
Yeah, I mean it's a very long trend. So I hope I remember the numbers correctly, but when I started Omega about 21 years ago now, about 40%, maybe 44, 43, whatever, % of all clinical trials were done by smaller companies. Yeah. So now it's about 75%. Yeah. So, and I think if you speak to most people in pharma, they acknowledge there's a real challenge in doing fundamentally innovative R&D at scale within these organizations. Again, there are exceptions. I mean, and there's always going to be phenomenal programs that these companies develop. Again, I mentioned Lilly and Novo. There's quite a few others. But it's almost a built-in structural issue. Yeah. These organizations are massive. It's super hard for a true drug developer to push forward for a controversial program. It's just not going to, there's going to be a lot of inertia. It's easier in a smaller company.
Yep. And I guess what's also, and I want, it's interesting, and I want to challenge what's your view on it, but what was interesting as well is that this number you mentioned of going from 45 to 75, what's interesting in the background is that it was positive from the ROI for pharma as well, as it was basically cheaper for them to buy in than to do the internal R&D. I'm wondering now with the size of the deals, when you pay 1.3 billion upfront for an early stage clinical compound or drug, it starts to be more expensive. Or if you pay whatever,
so we're talking about
10 billion for a company that is pre-revenues,
no, it's a great question. So, and listen, I used to run discounted cash flow analysis when I was a banker a few years ago. I think there's a couple of comments on that questions. Maybe I use the Merck Prometheus example, and then you mentioned iBio, which is the latest acquisition. By the way, we weren't the founders of this company, but we invested in the latest financing. So a lot of credit should go to the founders of the company, by the way. But so back to your question. So I think the thing that really shocked me when Merck announced the Prometheus deal, which was a relatively expensive deal. If I remember correctly, it was close to $13 billion, but 12.8 or something like that. The Merck share price went up by more, in terms of value, by more than the acquisition. And that is a fantastic result because it provides management of these pharma companies the cover to say, well, okay, we're doing top-line accretive, pipeline accretive transactions versus what they used to be able to do before the FTC kicked in, which were these financially accretive transactions where you basically buy big companies, cut down all the costs, you keep the drugs, you already have your sales force. But that doesn't give you top-line growth. And we need top-line growth in this business. That's what this business needs. You can't just keep engineering your way out of a lack of a pipeline. So that was something that really was important to me. And it's happened since. In a number of these other transactions, once you see them announced, very often the market cap of the buyer goes up by more than the value of the acquisition. You've seen this for a number of things that AstraZeneca and so on have done and so on. Now, the second question when we talk about iBio is that a lot of these acquisitions are for very large market opportunities. So I think the challenge right now, and it is a problem, I believe, for some disease and for some patients, is that pharma is really not interested in indications that are less than $1 billion minimum. And I understand that. I think it makes perfect sense from their perspective. So now, again, back to your question, what you're seeing, okay, it's a company that just finished a phase 1b/2a study, right? You're talking about iBio again. By the way, I wasn't the Omega board representative, but, obviously I was quite involved from our point of view. But it is an absolutely massive market. And what really shocked me when they announced the data at an ophthalmology conference is that every single patient responded. So what Merck has done, and by the way, there were other people interested in the drug, obviously, but what Merck has done, which I thought was very attractive to us and the company, was they're going to go straight into a registrational trial. So I think from obviously I don't have the DCF in front of me, but that is a quite phenomenal thing, because if you do that, and this is a huge market, right? You see what Vabysmo is doing from Roche, and there's a few other drugs on the market, of course.
Yes, it's a pretty large trial to run as well.
Right, so which is why this was a great fit for a pharma company. I have to say they're very good at that. They're very good at clinical trial execution for large trials. So again, I agree prices are going up in the space, but at the end of the day, that's what people need to pay. If it is a large addressable market, the option for these companies would be not to be acquired and go public, and it is still an open IPO market to be able to finance these large indications once you have very convincing clinical trials.
Yeah.
So that option is still viable. Now, obviously, you need a team that can execute on those large trials, and I agree, pharma is better there.
Yeah.
But at the end of the day, there's a bit of a competitive tension. Is this, am I the only bidder? Yes or no? Is it something that I absolutely need to diversify my pipeline? And what was interesting about Roche, this is their first approach into ophthalmology. So this will become actually a cornerstone asset, in my opinion, for the therapeutic area for them. I think that, obviously, I'm biased, but I think that more than justifies the price.
Okay. Good to hear. Yeah. I mean, also, the whole discussion makes me think about how much cash there is in pharma ready to be deployed. I remember, I think it was 2 years ago, from Nubar, from Flagship, to comment that there was whatever $760 billion in thing, and I think this month I saw the figure was more like 1,000 billion now.
It's close to $1 trillion.
Close to $1 trillion.
Well, I mean, these companies are very cash generative, right? And also they can leverage. They can raise debt without any problem if they wanted to. Yeah. They've phenomenally resilient businesses, right? I mean, it's wonderful to have a drug on the market, right? For a number of years, great margins. So there's a lot of financial firepower available to these companies. What they need is top line growth, and they're going to lose, I forget the exact number, but close to 250 billion of the current revenues will go off patent in the next 4 or 5 years. Yeah. It's a huge number.
And even you mentioned, I mean, Keytruda, now it's like 25 billion.
Keytruda, by the time you is off patent, it would be close to 40 billion. But she's an incredible.
But just 2023 was.
2023 was about 25, and I think this year is going to exceed 30 billion. No, it's an incredible drug, by the way. But to replace that, it's super hard. And incidentally, I mean, think about the problem that, Novo and Lilly will have in 4, 5, 6 years, right? I forget exactly which drug expires when, but between 2030 and 2032, both of the GLP-1s will go off patent.
They're also very good lawyers too.
Yeah, we can talk about patent extension tactics, and I'm not a huge fan, for example, of what happened to Humira, right? But that's a separate topic, which is an important topic, by the way, for the social contract. But I can tell you, both companies are already thinking, what will happen in those 4 or 5 years, and they're going to continue leverage those cash flows in 2 ways. First of all, they're going to have to increase manufacturing supply because they can't supply enough of this drug, and they will not be able to for years.
Yeah, I thought Eli Lilly is building like 6 plants or something like it.
So between Lilly and Novo, I think I've seen over 22 billion of investments in manufacturing, and this is probably an understatement. So, one thing is going to be manufacturing supply increase, and the second thing is going to be, pipeline acquisition. And I can tell you both companies are incredibly active into that. So you will see a lot of that cash flow being redeployed, in my opinion.
Makes sense, and it makes sense also of what we just discussed. Like, I mean, it's a good fit for them, I guess, that most of the optionality is on the early stage clinical assets, because this means if they buy it now,
yes,
then so 4, 5, 6 years will be ready. Okay, makes sense. I mean, we had Claudia Ulbusch from Cardio on the show who sold to Novo, and it was exactly this as well. Like, they just finished their phase 1B,
right?
Or 1B2A, I think. Had great data, and then had some options, but was basically the best options to go with.
I mean, what these people can do is really blow up the size of the future clinical development, right? They don't need to take shortcuts. They can invest in multiple trials, large trials. They can look at different indications. Yeah. So I think for a certain type of indication, for certain stages of the drugs, these people are the national buyers of these businesses. Now, I still think there should be some companies that go it alone. Like, look at what happened to, obviously, Regeneron was a while ago, Vertex. So we need those champions as well, not just a big pharma. And there are a lot. I mean, I forget what the exact number is, but I think there's over 100, more than 100 companies with market caps above 5 billion in our industry. And they are a great source of competitive tension, pipeline, optionality, partnership potential. Mm. So I think the ecosystem needs the very big guys, the not so big guys, and the small guys.
There's place. I mean, there's so much space as well. I mean, as you said, also at the end, I mean, from a benefit to patients and how it translates into economic value, there's just a huge need, and this drives.
So there's 2 things that make me. I'm glad you bring that up. First of all, I consider myself incredibly lucky. Right, this is an incredible job. You meet smart people every day. No, it's true, and it's you and obviously the CEOs that we invest with. Of course, you. But so we are quite fortunate to do this, and we should never forget that. But looking at it from the patient perspective, which was a great comment you made, we are truly in a golden era for our industry, because there's been an absolute convergence of a lot of technologies, CRISPR, cell therapy, gene therapy, AlphaFold, computerized drug design and discovery, blah, blah, blah. And we are better at deploying this for patients. We're not only better, we are faster. When I started, I think, investing a while ago, it would take 6, 7, 8 years to go from an idea to the clinic. Now, across our portfolio, routinely, this happens in 2, 3, 3.5 years, which is an incredible improvement. Yeah. And the drugs that are being developed are truly impactful. Again, not to keep going back on the GLP-1s, but everybody talks about it, so it might be an easy thing for your audience to understand. These drugs are truly impressive in terms of the effects they're having, not just on obesity or diabetes, but a lot of other diseases. So I think this has been, really we are at the cusp of a convergence of a lot of factors that are making this industry really impactful. Now, it is still expensive to develop these drugs, of course. We still need to figure out, particularly in the US, the affordability for patients. And I do think there needs to be a proper societal debate about how insurance works in this country. Obviously, I'm European, so I shouldn't talk about this.
Interesting, actually.
Yeah, but it's a very complicated topic. That's the problem. So for the normal average public, it's super hard, and it's easy to obviously paint the drug companies as the bad people. And there's been some bad behaviors for sure. When we mentioned Humira, but I do think this industry fundamentally wants to have an impact on patients and develop good drugs, and they need to be given the opportunity to do it.
I think we could talk about
that's a very long topic as well. Absolutely.
Next week, we talked about it just for your information, also for the audience. We talked about it with Tim from AlpInvest. Actually, the episode is not released yet, but we talked quite a lot and actually exactly about this because he is quite active in the US with AlpInvest.
Absolutely.
And making a lot of returns in the US. But at the same time, as British, with quite strong French anchor as well.
Yeah, his wife is French, and he speaks perfect French, actually.
And so he's also like, he was a bit, I mean, not schizophrenic, but a bit like, on one hand, okay, we need all the benefits. But the other hand, as a patient, like, actually, what we do in Europe is, from a drug access, is also not that bad. And
I think
the same on, like, what I find extremely difficult, and maybe you can comment on this, is like, is where to, if you need to take basically a decision and of what's the like close it, not ideal, but like what can be improved, because at the end, I mean, of course we need to find a solution, of course we need to make it affordable,
right?
But just I think at the end it comes down to, I don't know what exactly. For me, I feel like it's basically on like the margin where it's the key thing. I think. Are you talking about 20% EBIT for big pharma per year, or should it be 18, or should it be 15? To me, at the end, it boils down a bit to like,
yeah, I don't know if you want
to be awarded as well, but
and listen, I think this could be hours. Obviously, it is a super important topic, so I'll try to address it, and I'll make a couple of comments. I'll start from the point. I don't know if you want to regulate an industry that is so innovative as a utility, right? If you say, okay, you should have X% profit margins, I think they're going to...
And it's impossible to regulate.
Well, no, you could. I mean, but obviously very difficult, and there's a lot of second and third order consequences that are probably even hard to predict. I will make a couple of comments, maybe. One is that I think the social contract needs to be understood better by all parties involved. And the social contract is, you, society, give us a protected monopoly for this innovation that I will eventually bring to the market. So I will make the investment in that innovation. At the end of that protected monopoly, which is X years, right? Right now with the IRA is actually quite short. And by the way, there's a whole conversation about small molecule versus biologics, which is completely insane, but let's not go there. So at the end of the protected monopoly, that innovation will be available in perpetuity to society forever at much lower prices. So conceptually, it's a great social contract. There have been distortions. You mentioned companies who extend their patents for a long time. I think that is a behavior that should be fought against. The other thing that's very important is that the price of drugs actually doesn't go up as much as people think. And hospitals also never go generic, right? And the inflation of hospital costs and just billing on patients is actually much worse than drugs. So that's the second comment. The third comment is that in this country in particular, obviously I lived a lot of my life in Europe. I still spend a lot of time in Europe, obviously. But in this country in particular, there's a real issue about the way healthcare insurance works. Because, take the average European country, it's very often going to be a national health insurance program, which means the national health program will count on you being a patient for your entire life. So as a result, you can do an amortization of the cost of the therapy now versus your benefit in terms of your quality of life, your length of life for some diseases for a much longer period of time. So you can amortize the cost over a longer period of time. In the US, that doesn't happen. In the US, what you have is most insurance, because US obviously is a huge country, people change insurance, and your insurance is more often than not provided by your employer.
It's more private insurance.
So insurance companies
shorter term, and
they make the calculation that you'll be with them for 2 or 3 years. So this causes all sorts of challenges, and also there's this purchase benefit managers, these PBMs, whose whole reason for existing is they will extract a discount from the cost of the drug from the drug manufacturer versus the employers. The problem is that this actually pushes them to a very high list prices, because then the discount looks bigger, the profit is bigger, versus an actual net cost, which is lower. So, there's a lot of distortions in this country. At the same time, I think it is untenable that basically the US system continues to pay for innovation for the rest of the world. That's just not fair. For the US, it's not fair. So I think some kind of equilibrium needs to be.
Ija from Unico said that it's something around, if you calculate around 3/4 or 80% of the cost of it covered by the US.
Right now, in terms of profits, this country is probably the overwhelming majority of the profits of all the pharmaceutical sales in the world are in the US. Again, the country also reaps the benefits, right? A lot of the research and innovation is here. These are high earning jobs, so they pay taxes. There's a lot of investments. I mean, look just at this city, the amount of investments. I mean, go look at the seaport, what all these pharma companies, including European pharma companies, AstraZeneca and so on, have been making as investments. So the US also benefits from that. And by the way, they will continue to benefit because this industry is actually a very strategic industry from a lot of perspective. But again, very long topic. And I think you should speak to people who are better equipped than me, but it's a fascinating topic.
Yeah, I will just mention also for the audience what you're saying about the hospital costs not going down versus technology/drugs that go down. Reminds me of Peter from Koszylski from RI Capital. And Peter
said a lot about this.
He's very into...
As he should, absolutely.
But very into one side, but I think he goes very deep. And at least it's very well researched. I would say, I mean, not biased, but very opinionated and taking one side.
We all opinionated.
That's very interesting to see.
No, and Peter, to his enormous credit, has spent a lot of time researching the topic, trying to make it available to a broader audience. He's obviously a fantastic thinker, so he should be commended for trying to explain this. It's a very difficult topic to explain because the slogan from, one side is the drug company is profiteering, right? That's the quick slogan, which is very catchy. And our answer is war and peace, 850 pages. I mean, that's obviously very difficult for the general public. Anyway, interesting topic.
It's a great topic. We could talk a lot, and I mean, amazing first part of the conversation. Before continuing this, I want to take a bit of a tangent to more your personal history, also for our listeners to understand also where all these comments come from and where you come from. And especially as you mentioned, I mean, we're here in Boston. You grew up in Italy, started studying Italy, lived quite a lot in Switzerland, Geneva. Now, I think most of the time in Boston, but still quite a lot.
Try not to be in the winter, though.
You prefer to ski in Switzerland.
Yeah, I do prefer to ski in general, but the winter is a little bit tricky. I'm from the south of Italy, and I still have and obviously, as you can tell, I don't have a lot of hair cover. But everybody, I mean, it's a wonderful city to be, particularly this time of the year. It's absolutely amazing.
Yeah, absolutely. And can you tell a bit, like, in short, or expand a bit on your background of what's kind of pre-Omega and maybe some of the lessons there you had as kind of, as I said, the European, a bit 2 foot on both continents, especially connected to biotech. Like.
Right. Yeah, I can do a quick bio. So, yes, obviously, I studied science quite a bit. So I actually have a couple of PhDs. Doing my PhD in Switzerland, I did 3 years of patent law, which was very interesting for me at the time. Then ended up working in an investment bank. So I was at Goldman Sachs for a few years in London in the mid to late 90s. And that was a period that saw a lot of pharma M&A in Europe, and Goldman was working on that. So it was very exciting. Then eventually I joined a very large private equity firm in the Netherlands called AlpInvest Partners. They're now part of Carlyle, which is obviously a big buyout shop. And they're...
As that big worse.
Yes. They're all these very large private equity shops have figured out, in a sense, that this is a very unique asset class, which is hard to invest in and develop without some very specific competence, like what we have been trying to build. Exactly. And interesting enough, a lot of our peers, ourselves included, have been approached for some kind of partnership or whatever acquisition from all these shops, because it takes. I mean, the joke, and it's not really a joke, is that I'm in my mid 50s, and I've been doing it now for 25, almost longer than that years, and I'm getting good at it now. So and people laugh when they hear it, like you said, but it's true, because it's a very long apprenticeship process, and persistence in this industry is really disproportionately rewarded. But back to your question about my life. So I ended up at AlpInvest, and I was there in the Netherlands, which was a wonderful place to be and a wonderful time to be there. I spent a bit of time in our New York office as well. And I had 2 jobs, actually. One was to build a investment portfolio on the healthcare side, but then I was also helping the fund of funds team on building some kind of framework analysis for investing in venture funds. And so they gave me a lot of exposure to different styles of investing from these GPs and these venture funds, and different geographies and different type of companies that they were investing in. And the thing that really struck me is that more often than not, drug companies were the most consistent sort of exits. And that looked simple enough. But then when you start digging what's going to be needed to be successful about investing in drug companies, it's actually very hard. So it's an easy recipe, but very hard to execute. It's almost like Italian food. So the recipe is very simple.
I love pasta.
Right. So do I, obviously, as you can tell. But so the recipe is relatively simple, but the quality of the ingredient is absolutely essential. And if you mess up one ingredient, it's
working on my true carbonara from...
yes. We can
I still don't manage to get the eggs perfectly right.
You gotta get the guanciale. Guanciale is the secret.
I have the guanciale,
okay.
The egg part at the end, but anyhow.
Yes. Well, we can talk about that as well. It's one of my favorite pasta, actually.
Well.
So I decided, okay, this wasn't going to be necessarily the place to do it. And actually, just a few weeks before I got married, I decided to kind of spin out. And I became a consultant for about the companies for a few years to just raise money. And then we started raising a very small first fund. We did it in 2004 out of Switzerland. And then, try to raise capital in Europe at the time was difficult. I think still is. I don't think there's a real appreciation in most institutional investors' portfolio for the asset class. And certainly there wasn't at the time.
I think still, yeah.
Yeah. I think, well, it's changed a bit.
But it's still harder.
But it's still hard. I mean, it's funny. Most of the conversations I used to have, and I still do to a large extent, with European investors, that they don't understand the asset class. And, okay, I'm sympathetic to that. But my joke to them, and some of them get upset actually when I say that, but my joke to them is that, well, if you were to understand this asset class, why would you need me or our firm, right? I mean, we have, 13, 14 PhDs here, MDs and all that, and we don't look at discounted cash flow. That's a relatively commoditized tool to look at the, private equity companies. We look at one drug versus the other, the quality of the management team, clinical development strategies, what are the potential buyers, competitive landscape, blah, blah, blah. So it's very complex. But once you handle that complexity, there's an incredible moat to protect from competition. Also, and I don't know if people really appreciate...
Returns are just there.
And the returns are there to a certain extent, independently of market conditions. Because if you invest, and again, this is something that I don't think the industry does a good job of explaining to our own investors. We try, hopefully. But if you have a drug that addresses a very severe unmet medical need in patients, and you show data that demonstrates an impact on those patients, well, that is the most uncorrelated asset class on the planet. You don't care about China, you don't care about the war in Ukraine, you don't care about inflation, you care a bit about inflation, you don't care a bit about unemployment rates.
Compared to other asset classes, I guess you care.
The tech industry, a huge part of the tech industry, is actually much more subject to those macro factors than drug companies are.
And even to our discussion, you see it today. I mean, Keytruda.
There you go.
Even with uncertainty,
I don't think anybody cares. So I think the again, if you invest in this specific aspect of our industry, which is drug discovery and development, there's a lot of uncorrelated returns that can be met if you can pick the right drugs.
Yeah.
Right. And actually, maybe I should have started with this. One of the statistics we are proudest of at the firm is that over the last 20 years, we've been involved with companies that have launched 50 drugs on the market. That's a huge number.
Yeah.
And obviously that has had an impact on patients, which makes us very proud. But it's also had an impact on our investors because of those exits. So I think it's a real unique opportunity to have an impact on patients and society, providing uncorrelated returns to your investors, and work in a very exciting field.
Yeah.
So that was very difficult to explain in Europe. I think we probably are doing a slightly better job of that now, but there's still a bit of a reluctance there, to be honest. The U.S. investor community has always been much more prone to accept this type of investment. Obviously, a lot of endowments, foundation, pension plans have been investing in the sector for a long time, and they've done quite well out of it.
And with the venture capital basically being started here,
Correct.
Especially in Silicon Valley in the 70s,
they're much
more background and
exactly.
everything.
So they're more familiar with
those.
So we opened a Boston office here in 2007.
Yeah.
I eventually decided to move here myself. And honestly, I should have done it earlier, to be honest, in our life. And now I spend my life a little bit, across both parts. But it's been quite rewarding. I think it's truly incredible, particularly in Boston, what can be done in this ecosystem. I mean, my comment to some of my European CEOs is that you need to start planning to have a presence here as soon as you can, because the capacity of recruiting exceptional talent in this town, in the US in general, but in this town, is truly incredible. And it's because, at the end of the day, it's a huge city for biotech, but it's a small city overall. So we all run into each other constantly, like literally. On the way over, I saw somebody that I knew. I had to say hello for 5 minutes. So, and it happens to me every day when I walk from my apartment. So it's kind of a truly unique ecosystem, particularly for therapeutics.
That's amazing. I mean, if people can see with the view, but basically, I mean, if you have Kendall Square there and you add Seaport, I think that's basically, like, I would say maybe 20% of the world biotech or something in this area.
And pharma.
Yeah, biopharma, biotech in like whatever.
Few square miles.
Yeah. Which is so dense.
I saw a statistic, and honestly, I haven't been able to find it again. I need to go and do a better job. But I saw statistics that I believe was 2022 or maybe 2023 or maybe 2021. Boston received more therapeutic drug, development investment than the rest of the U.S. combined that year. I mean, that's an incredible statistic. So yeah, there's a huge concentration. There's always, like, almost every other week, there's a big conference on, cardiovascular, cancer, stuff like that. Always the big ones are ASCO and ACR, but there's much, more focused conferences here. And it's a small city, as you said, right? So you bump into each other, and that kind of Brownian motion is very conducive to business, because it used to be So if I can take an analogy for a second, it used to be, so you had the hardware and the software, right? The hardware is the technology improvements, so CRISPR, drug discovery, X-ray crystallography, all that stuff. The software is the people who can transform those technologies into drugs. And that drug development expertise used to be locked up within big pharma companies, like up until, I would say, 10, 15 years ago. These people would not leave pharma. They didn't think you could do a good job developing a drug in a small biotech. Now that's completely changed, right? These people are actually very happy to leave pharma because they don't have the bureaucracy in a lot of cases. And biotech companies can actually now raise the money to do the proper drug discovery and development work that they need to do. So there's been a much more fecund intersection between those two industries that used to be, not necessarily as joined to the hip as they are now. And in this city, you see it very clearly. I mean, literally the amount, there's head of R&Ds of pharma who come here to our office almost every day. So and we learn from that, and we learn what they need, and we try to put it together for them. So it's a very symbiotic ecosystem.
That's maybe on what I like was it's a great summary and lessons on your background. Just to go back, I like this part. I was always curious when I saw your track or whatever, the different steps. I was curious, and I was missing a bit the link of what brought you into venture, into like starting your own venture fund. But now I kind of get it. But can you tell this, like, and you just said like it took you, now you're just starting to be good, which reminds me about Warren Buffett who said, 10 years ago, I wasn't sure what I was doing.
It's true though.
I guess,
20 years ago,
is learning a lot, but can you tell maybe from, if you remember how it was basically 2004 to 2010, like, or some of the lessons you had of like moving into venture, especially I think a lot of people listening to us want to go into venture or think it's a wonderful world. I think it's also nuanced, but maybe what was some of your lessons there? Like,
and to be honest, I was always excited about the idea of getting into venture, and I ask advice. So the one thing I would ask people is advice. But back to your question in a second, and there's one particular person who was very helpful in providing advice, Kate Bingham at SV Life Sciences, that you probably know.
Yeah.
And so she told me, I was still doing my PhD, and I asked her, well, I would like to get into venture. She had just got into a venture fund a couple of years before me. And she told me, well, there's a couple of ways. You can start as a junior person with a scientific background.
But that was why.
That was a long time ago. That was 94
Goldman Sachs,
everything else.
Wow.
I was still doing.
You're already thinking about venture?
I was already thinking about venture.
Wow.
I wasn't obsessed about it, but I enjoyed the concept, and I wanted to figure out how would I get into it.
Yeah.
And she said, well, you can start as a junior analyst or whatever with a scientific background, but you might end up being pigeonholed in a research-only kind of role. And I was already consulting for a few venture firms and banks at the time, and I saw that happening.
It takes very long to...
And it would take very long.
Analyst, associate.
Or you go out and learn something after your PhD, like another skill set. So I went out and I joined a bank to learn, because I knew nothing about finance. I didn't know how to use Excel. Now I can probably make coffee with it. So there was very good advice. And now, the lessons learned, there's a lot of lessons. I mean, this is the ultimate Renaissance job, right? You need to be good with people. You need to be good at analytics. You need to have a lot of content, because without good content, it's very hard to make good convictions and good investments. You need to, be sometimes brutal, because sometimes there need to be changes in a company, and they're not fun, to be honest.
Decisions, yeah.
And if you avoid that discussion, no good things happen. But I like this aspect of having to learn to do a lot of things. And obviously, I like to continue learning. I also like the impact that it has, as I mentioned earlier. But, lessons learned, so many.
You mentioned,
Yeah, so, hiring the right people is essential, in my opinion.
Actually, didn't talk about your co-founders, because I think...
That was just me at the beginning, really.
Yeah. Okay.
Yeah. But eventually, yes, I had a few people joining me, and at the beginning, probably they weren't the right people, and then eventually we managed to figure out how to find the right people. But there's also natural.
You're the only founder left still operational, no? Right?
Yeah. I'm always a bit operational. I'm trying to be a bit less operational and focus on other things. But yeah. So the history is that really it was me for a few years, like 2 or 3 years, and then we started having general counsel, CFO, some junior investment professionals, and then eventually, as we managed to grow, we added more senior people and so on. So I think again the evolution can be fast or slow depending on where you start. Again, lessons learned. Again, I should have probably moved to the US earlier because it would have allowed us to, scale the organization and the fundraising faster, and that would allow us to hire a certain type of team earlier. But, there's also personal choices, of course. But the other lesson is don't fall in love with your investments. I mean, obviously, we need to be passionate about it because without passion, nothing happens really in our business. But in some cases, you need to take a cold, hard look at your investment. At the end of the day, we are investors. So our job is to make a profit for the people who entrusted us with their capital.
And to help patients. Yeah.
Yes. No, the things are not mutually exclusive.
Yeah.
On the contrary. But you need to keep in mind that you cannot stay on a board forever. You cannot be an investor in a company forever, and so on and so forth. So that's
very hard scale of how much passion you put and how much you need still a bit detachment.
Yes.
I mean, I have the same problem with my own companies I'm building. Is
it's super hard. And it's not something you learn quickly. You need a few very difficult lessons early on in your life. And I did that. I had quite a few mistakes early on that made me realize how important this is. The other thing is working as a team is very important because nobody knows everything and nobody knows everybody. So trying to have a culture where it's not just one person making the investments from the beginning to the end, but you have a real team around you that can also exercise dissent because, it would be super easy for everybody to just do whatever the senior people say. But sometimes you got to really listen to objections. And again, that culture is quite specific. And I think it did help me being in the Netherlands for a few years because the culture of AlpInvest, and I don't know if you know many Dutch people, but they're incredibly straightforward. Yeah. So to a certain moment, I was actually shocked. Yeah, right. So to a certain, I remember my first investment committee at AlpInvest where they really kind of went at each other. And I say, whoa, okay. So that was, but you need to encourage truth-seeking behavior. So I think we try really hard, certainly encouraging the junior team to express dissent. Because at the end of the day, you shouldn't care about how you're saying something. What matters is what you're saying. And this is a lesson that is very hard to accept for a lot of people. But, we keep trying. So again, there's a lot of other lessons. I mean, this could be a whole kind of section by itself. But fundamentally, perseverance pays off in this business. Yeah. And perseverance also in maintaining relationships. Sometimes, we say no to companies for years before we decide to invest. And for some management teams, that is very hard. And I understand that. I had the same thing on our end. We had investors, we invested with us. Exactly. So at the end of the day, you need to invest in the relationship. It shouldn't just be, we're raising money within the next few weeks. Are you in or you're out? These are, in this industry, you have relationships going decades. Yeah. So you got to invest your time using that time frame.
Yeah. That's great. That's great lessons, I think. But I think as every lesson as well, it's hard to apply them like individually. I think they also go into a bigger package. And right. What you just said, giving super honest feedback, yes. But what you just said also, if you know the person and you have trust, then your honest feedback is very different versus if you don't know the person, you just give a super honest feedback.
So that's super hard, right? And one of the things that I hear a lot from entrepreneurs is, we like to understand why you're investing, or if we are investing, I don't think they care why we're investing, but they like to know why we're not investing. And it's it's a fine line because we like to be thorough and we don't like to obviously ghost people, but I don't think we can be super honest either. because people don't take it well. And there's real game theory about this where, you know, you want us to be honest, which I'm happy to do, but I see more often than not that then 10 years later, when you do something that I'm really interested in, you're not going to talk to me because you didn't like the feedback I gave you 10 years ago, even though the feedback might have made you who you are now.
And it's your opposite as well. I mean,
exactly.
Yeah.
So it's kind of funny, and I hear this advice from a lot of my peers that entrepreneurs enjoy being, you know, getting feedback from VCs, and it's true. I don't think they would enjoy the full feedback. And that's a challenge.
Then it's a gradient, and where,
of course. And again, I learned too much from the Dutch, maybe, so I kind of lost a little bit of my Italian kind of nature, I guess. But it's a dilemma because it would be my instinct to be very honest, but the reality would be incredibly damaging to me personally, to my relationship to the firm. So sometimes I just gotta say, well, you know, it just wasn't a right fit for us at the time, whatever that means. So there you go. Probably I shouldn't have said on this, by the way.
Yeah, I like. I mean, for anyone, if there's entrepreneurs here, if you're going to fundraising, it's hard to take care, but
and I'm very
it
sympathetic.
comes also from experience. I mean, it's complex. But I like everything. A lot of good lessons. There's so many things we could discuss.
Well, life is long, hopefully.
Life is long. Then we have a few minutes left. One thing that's maybe on the like, you should have moved to Boston earlier.
Or to the US, yeah.
Or to the US in general, but Boston, like, I can quite relate to that. And I'm wondering, on your side, how you mentioned quickly, there's a personal side to it as well. I think at the end, that's the hard part. I mean, as I told you before, but I studied at BU, just like somewhere there. I finished my studies here, worked at Kendall just 10 years ago, but at some point I moved to Berlin to start a company. I'm still in Berlin. I come to Boston quite often, and it opened my mind as well, etc. But still, like, and ideally, I would like to split myself or whatever, but that's also very hard. And I think, I mean, at the end of the day, for me, it was also quite personal choice. If I look at basically, if I listed basically everything, kind of more trade-off in Boston, for me, to my personal taste, in my personal life, everything was better in Europe. So everything from, I don't know, family, close to family,
of course,
food. I guess you can find good pasta here, but I mean,
important topic.
With the same level of pasta or food, and
well, just above Italy here, so it's all good.
Still okay. I mean, but food in general, I mean, culture, architecture, infrastructure, whatever, like a lot of things, you can say healthcare, social, whatever, a lot of things. But business was clearly way above. I think for anyone in biotech or in tech, if they're in Silicon Valley, it's clearly above. I'm wondering, how did you come to that personal decision? Like, did you just prioritize business over personal life, or what kind of trade-off did you have to face?
Yeah, I mean, all the trade-offs that you just mentioned, right? So, I mean, first of all, I didn't come to the decision all by myself, obviously. Yeah. So if you have a partner in your life, that partner needs to be part of the decision. I mean, maybe a bit of background. So I think I moved 1, 2, 3, 4, 5, 6, 7, 8. I moved 8 times in my life. And by move, not apartment within the same city, countries. And really started after my undergrad, or maybe even before that, because I moved from a little village to go study close to Milan. And that was very important for me. It was a huge decision for my family. We certainly couldn't afford it. But it was also a huge period of personal growth. It opened up what was a very small provincial mentality of mine at the time and exposed me to, still a small university town, but very different scale. So in a sense, I've always been more perhaps prepared for that than the average perhaps person. That doesn't make it easier. I remember.
Doesn't make it easy, but makes it probably easier.
Correct.
Yeah.
No, very good actually. Thank you for saying that. You're right. It doesn't make it easy, but it makes it a bit easier, at least mentally.
Yeah.
And also, to be completely honest, moving is a little bit easier now, also because I've achieved a certain level of comfort. So stuff that when I was 20 or 25 or 30 was hard because I couldn't afford to do it in comfort. Now it's a lot easier. So there's a gradient there as well, but I've been able to achieve the level of comfort. And listen, I work very hard, but also because of the opportunities that have been given to me over time by my parents who insisted on education, my college, who also was a great place to then be able to network, learn English, whatever. And back to your question about these trade-offs, this remains the country that gives you a lot of opportunity. So I'm very grateful to that. And you know, the scale that the business has reached would not have been possible without moving here and build a real presence and you know, an establishment here. So, you know, you got to work on your priorities.
You think not possible or not possible as fast? Just as a...
Probably not possible.
Not possible, okay.
I mean, it's hard to do the counterfactual. So it's hard to prove the reverse, of course, right?
A/B test.
But yes. But I personally think it wouldn't have been possible.
Okay.
That said, I think it is a very personal decision, right? And to be honest, there are a lot of factors, right? You have kids, are they going to school? What do they...
I was about to ask.
So I don't have kids.
Okay. Yeah. I was about to, because...
It's very different.
My wife is in biotech, so most of it would fit well. We're talking about kids, and that's where, like,
that's super.
The moving becomes, like,
again, this is where this country is an advantage, in a sense, because... not because their child care policies are very advanced, not because of because school is bad. No, but there's something to be said for a unified, you know, currency, culture. The school system is more or less, I mean, obviously it's highly stratified depending on your income, but it's more or less the same. So you can move across the country here and have a fundamental understanding on how your system works. Whereas, say you want to move from Berlin to Bern, in Switzerland, as you know, and that would be a very difficult decision. So I think there's a lot of corollary benefits that I don't think people understand about a single legal system, a single currency, a single language, a certain way of doing business, a single listing even for our companies. Whereas you look at Europe and there's all this incredible fragmentation. And listen, don't get me wrong, I love being in Europe. I mean, I speak 3 or 4 languages. I lived in 7, 8 different cities, all that. But this country remains quite incredible when it comes to the opportunity that it provides and the ease with which you can then take advantage of that opportunity. Now, hopefully, that will continue to be the case for a long time. Already starting to see challenges with that in the educational system. But back to that decision, you know, in retrospect, it was the right thing to do, but it was a very difficult decision, even for me at the time. So I don't think it's easy. And
I guess there were even some difficult decisions on the way as well. After the first one of like stay or come back, or I guess over the 20 years, I can imagine.
I remember the first winter here, which was this incredible winter, the first full winter here, where you know, we had an apartment and so on, a small apartment we were renting. And it was the period when I think it did 100 and something inches of snow in the park and everything. So every weekend there was a blizzard coming in. And at the time I wasn't aware of Canada Goose and all that. So it was very interesting for me as a winter. So I literally 3-4 weeks in, I said, oh my God, this was the worst decision of my life. So sometimes you got to stick with it. So that's the other lesson. You got to stick with it. Because again, perseverance is probably the single most important trait if you want to succeed, particularly in an industry like ours, where it takes a long time to become good at it.
Yeah.
You got to persevere.
It's amazing. It's amazing how the whole discussion, everything fits together from the early days, the perseverance, the like longer term, already like commitment to science, already interest in VC, to Yeah, I like it a lot.
Well, there's also been a lot of luck, right? Sorry to interrupt, by the way, but I don't want to make it look like there was this great plan, right? And it was always been like this. There's been a lot of zigzags, and the people you meet along the way are very important. So I wouldn't be here if I hadn't met Kate, if I hadn't met the person who gave me a job at Goldman.
So Kate brought you the iBio deal.
Yeah, she brought me the iBio deal. Exactly. No, I'm very grateful to Kate. She's really a person I look up to a lot in this business, and she's done really, really well for herself, for her investors, for her patients. So it's important actually to identify these people that could make a difference in your life. Because, I mean, literally I got a job at Goldman because I ended up sitting next to a person at the conference. So this is where being Italian is a massive advantage, right? We talk to everybody. We are more or less inoffensive. Nobody hates Italians, really. Maybe the French every once in a while. But there's, and I speak a few languages. So again, if there's an advice I would give to people who are, in school or thinking of a career, doesn't matter what you end up doing, but being able to relate to people, being able to connect with people, being intellectually curious, and then persevere, you're going to go far in life. That's important. But again, now it looks like a good ending because it is. I mean, I'm pretty happy as a person. Not what most people say about like. Yeah, I mean, there's always something to do. I mean, I'm not a person who kind of stops. Oh wow, we're good, we're done. I really don't have that mentality, and that's a challenge for some of my coworkers because I'm never super happy. Yeah. But I'm happy with what we have achieved. But we can do more, of course. But I think you need to persevere. That's
if we go into happiness, we can do one more.
It's a whole other session.
It's amazing, Otello. I'm just seeing the time, and now you have a hard stop, so. Amazing. I think we should do a second episode at some point.
Oh, sure. Absolutely.
And I had so many more things I wanted, but thanks a lot.
Thank you. Really a pleasure. Thanks very much. Wow, that was nice.
Thanks for listening to the end. I'm impressed by the clarity of Otello, especially on the exit side of things. I'm also very inspired by his career decisions and how everything fits together, especially when looking back over a few decades. If you've also enjoyed this episode, please hit the like, follow, or review button. Any of these actions would help us a lot. I would also be curious to hear what you think, so I can further improve the content. So if you could leave a comment wherever you are, or shoot me an email at philip@Flot.bio. All right, see you in the next episode.